Live Well, all about glaucoma, presented by Robyn Aprey and Elizabeth Ball from Glaucoma UK on the 10th of March 2022. About Live Well. Live Well is a series of events aimed at helping people make the most of life with sight loss. Live Well is a collaborative project between 6 local independent sight societies. Sight Advice South Lakes, Cumbria, My Sight's Not, Nottingham, Sight Airedale, in the Airedale area of North and West Yorkshire, Support for Sight, in Mid and West Essex, Sutton Vision, in the London Borough of Sutton, and Outlookers in Huddersfield in West Yorkshire.
Good morning, everybody. Welcome to the, we call ourselves the Rainbow Group at the moment. This, as you know, it's 7 sight loss organisations around the country. So who have we got this week? We have Robyn and Liz from Glaucoma UK. And this week is World Glaucoma Week. And that's why we invited them, because we saw World Glaucoma Week was coming up. We thought, well, seems the best time to have them. So over to you, Robyn and Liz.
Hello, everyone. And thank you all for joining us today. So I'm Liz Ball, Glaucoma UK's Development Manager for Northern England, and with me is Robyn Aprey, Development Manager for Southern England. And we're going to be talking today about glaucoma, what it is, how it's treated, particularly with a focus on eye drops, because that's one very common treatment, and also saying a bit about what Glaucoma UK does, and then just a little bit about how common glaucoma is and how that's changing. Slide 2, please, Robyn.
Great.
So,
yeah.
Glaucoma UK is the only UK charity specifically for people with glaucoma, and our mission is to stop preventable sight loss due to glaucoma. There are 3 main areas to our work. First, we campaign to raise awareness of glaucoma. We want people to know what glaucoma is, and we want them to know about the importance of getting their eyes tested, because the earlier glaucoma is detected, the better the chances of keeping good sight for life. Second, we provide support and information to people with glaucoma and those who care for them. We have information booklets, a helpline, buddy service, and we offer support groups. And I'll say more on those services later on. We also provide training to eye care and sight loss professionals. The third strand to our work is funding research. So we fund early stage research into the diagnosis, treatment, care and prevention of glaucoma. We're not a big charity, so we don't have massive pots of money, but the money we do have, we put towards getting research going. We are a membership organisation, membership charity, and anyone can join as a member. And we also have a professional membership scheme as well. Slide 3, please, Robyn. So what is glaucoma? Glaucoma is the name for a group of eye conditions that damage the optic nerve. The optic nerve is the nerve that takes visual signals from the eye to the brain. And if that nerve is damaged, then it can lead to sight loss. Glaucoma is quite a complicated disease, and it's not just one thing. It's as I said, it's a group of conditions, and the diagnosis can be quite tricky. And so very often you'll need several tests to confirm the diagnosis and to explore why damage is occurring to the optic nerve. Most of the time, glaucoma is caused by high pressure inside the eye. Now, to understand that a little bit better, it helps to understand something about the structure of the eye. So the eye is shaped like a ball with a bit of a bulge at the front. The tough wall of the eye, that's the white part of the eye, is called the sclera. The surface of the eye is covered by a thin skin called the conjunctiva. And the clear part at the front of the eye is called the cornea. Behind the cornea, inside the eye, is the coloured part of the eye, and that's called the iris. And the hole in the middle of the iris is called the pupil. Behind the pupil is the lens, and the lens helps to focus the light that comes into the eye onto the light sensitive cells in the retina at the back of the eye. The space in the eye between the cornea, the clear part at the front, and the lens is filled with a clear fluid called aqueous humor, or often just aqueous. Aqueous is a clear fluid that is constantly produced inside the eye, and it takes nutrients and oxygen to different parts of the eye. And it's the aqueous that is responsible for the eye pressure in the eye. And that's sometimes called the intraocular pressure, or IOP. But generally we'll try to just call it eye pressure because that's easier. Just to avoid confusion, aqueous is different to tears. So aqueous is inside of the eye and takes nutrients and oxygen inside the eye, whereas tears are produced outside of the eye and help to moisten the eye's surface. Slide 4, please, Robin. Now, as I said, it's the aqueous that is responsible for eye pressure. And for the eye to have the right pressure, there needs to be a balance between the amount of aqueous that's produced and the amount that drains away out of the eye. So the aqueous is made in a tissue behind the iris. It's called the ciliary body. And the aqueous then flows through the pupil, that's the hole in the middle of the iris, and drains away through tiny channels called the trabecular meshwork. The trabecular meshwork is positioned in the angle that forms between the cornea, it's the clear part at the front of the eye, and the iris, the coloured part of the eye. And this is often just called the drainage angle. So in most eyes, there's a balance between the amount that's produced and the amount that drains away. The pressure might vary a little bit throughout the day, but it remains within a fairly constant range that the eye can handle. But what happens with most glaucomas is that balance, gets disrupted and the pressure starts to rise. And it can actually help make this easier to understand if you think of it just like plumbing. Think about a bathtub. If a bath tap is turned on whilst the plug is unblocked, the water will drain away out of the bathtub and the level of water in the bathtub won't rise. But if the plug is blocked and the tap is turned on, the water can't drain out fast enough and the water level will rise. And that's just like in the eye. If the drainage channels out of the eye aren't working as well as they should, then the aqueous fluid can't drain away and the eye pressure will start to rise. Now, a certain amount of pressure is needed for the eye to keep its shape. But if it gets too high, it can cause damage to the optic nerve. It restricts the blood supply to the nerve, and it also directly presses on the nerve. Both of those things can cause damage. But to complicate matters, glaucoma can also develop in some people when eye pressure is actually in the normal range. And this is known as normal or low tension glaucoma. Some other people have higher than normal eye pressure, but there's no damage to vision. And that's called ocular hypertension. And it's really important that people with ocular hypertension have their eyes monitored regularly, because it can develop into glaucoma and they could start to experience vision loss. But if they're having their eyes tested regularly, then that should be avoided. Slide 5, please, Robin. There are a number of different types of glaucoma, 3 main ones. The most common is primary open-angle glaucoma, which is sometimes known as chronic open-angle glaucoma or just as open-angle glaucoma. And it's estimated that around 2% of people over the age of 40 have primary open-angle glaucoma, and that rises to as many as 10% of people aged over 75. Primary open-angle glaucoma develops very slowly, and to begin with, it's often symptomless. So people might not actually realize they have it, but the damage is still being done. And this is why it's so important to get eyes tested, because glaucoma can be picked up in its early stages and at a routine sight test, when you might not notice that there's anything wrong. In most cases, primary open-angle glaucoma, the drainage channels don't work as well as they should, and the aqueous can't drain out of the eye fast enough, so it builds up in the eye and the pressure goes up. And it presses on the optic nerve and on the blood supply, and it can lead to sight loss. But it's very gradual, and so the damage is very gradual. And usually the damage begins in the peripheral vision, the edges of your vision. And because both of your eyes work together, if you've got a patch of blurry vision or a patch of missing vision in one eye, the other eye can compensate. So you don't necessarily notice that there is damage. Plus, even if you have blurry or missing patches in both eyes in the same place in your field of vision, the brain is enormously clever and can fill in those gaps. It makes assumptions about what should be there, so you don't necessarily notice it. But as the glaucoma continues and damage increases, then you could begin to notice sight loss. But if it's picked up early and treated early, there's a really good chance of keeping good vision. The second type of glaucoma is primary angle closure glaucoma. Now, this is a little bit different. It can be chronic. In other words, it develops slowly, just like primary open angle glaucoma, but it can also be acute. In other words, it develops suddenly. In primary angle closure glaucoma, the angle between the iris, the coloured part of the eye, and the cornea, the clear part at the front of the eye, is squeezed. And that stops the aqueous fluid reaching the drainage channels, the trabecular meshwork. And so the fluid builds up, eye pressure goes up, and damage starts. Now, some people naturally have a narrower than average drainage angle. But that doesn't necessarily lead to vision loss. In primary angle closure glaucoma, the angle closes gradually if it's chronic, and the eye pressure slowly rises. And again, to begin with, you might not notice it. But it's different with acute angle closure glaucoma because this happens suddenly and it's usually very painful. And you might see halos around lights or notice other disturbances to vision. And this should be treated as a medical emergency. And if you think there's a possibility that you could have acute angle closure glaucoma, you should go to A&E or eye casualty straight away. Eye doctors can treat glaucoma in a number of ways, but one thing they may do, particularly in angle closure glaucoma, although increasingly also in open angle glaucoma, is to use laser to improve the flow of fluid through the eye. And that's the same, even if you just have narrow angles, they might do that to help the fluid flow to prevent glaucoma developing. And as I said, some people do naturally have narrow angles. For example, people with small eyes, people who are very long-sighted, or people from certain ethnic groups, such as East Asian. And that's simply because of the natural shape of the eye. The third type of glaucoma is secondary glaucoma. And this is when glaucoma happens as a side effect or secondary to another underlying medical condition or to trauma. And this differs from primary glaucomas where there's no identifiable cause. The difference here also is that with secondary glaucoma, if the underlying cause could be treated, then the eye pressure may go down without further glaucoma-specific treatment, although it's not always possible to treat the underlying cause. Depends what it is. So those are the three main types of glaucoma. But a fourth one, which is worth being aware of, but it is much less common, is developmental or congenital glaucoma. This is when glaucoma develops in babies in the womb, and about 1 in 10,000 babies are born with glaucoma. Some types of congenital glaucoma are genetic, so they're passed on from parents to children in genes. Others are part of broader conditions or syndromes. So in brief, that's what glaucoma is. So let's now think about how glaucoma is treated. Robyn, slide 6, please. Eye drops are a really common treatment for glaucoma. If you have glaucoma, you've almost certainly used or still use eye drops, but they can be a bit of a minefield. There are lots of different types. You may have to take more than one type. The bottles are all different, and it can be quite tricky actually putting them in. And a little bit later, Robyn is going to be giving some tips for that. Slide 7, please, Robyn. So that's a lot of information there. So this is just a slide with a little quote to break it up a little bit. Hey, Bill, how did you get on at the eye clinic? Because it's really important as well that, you know, you feel that there are people you can turn to if you want to talk about your glaucoma. You know, talk to people and share experiences. Slide 8, please, Robyn. So why use eye drops? As I've already said, glaucoma is usually caused by a buildup of aqueous fluid inside the eye, leading to raised eye pressure and damage to the optic nerve. Eye drops either increase the drainage out of the eye, or they reduce the amount of fluid produced inside of the eye, or in some cases they do both. And that leads to reduced eye pressure. If eye drops are used regularly as prescribed, they can help keep pressure at the right level and help avoid sight loss. Eye drops are usually something that people need to take for life. It's not like a course of antibiotics where you might take it for 6 weeks and then you're recovered and you don't need to worry about it again. Normally, you'll need to take eye drops forever. So what do eye drops do? Slide 9, please, Robyn. There are lots of types of eye drops for glaucoma, but they all do the same thing. They all try to reduce pressure by increasing drainage or slowing down the fluid that's produced inside the eye. And some do both. Which drops are best for you will depend on the type of glaucoma you have. So I'm going to hand over now to Robyn to give some tips about actually using eye drops.
Thank you very much, Liz. So here are some of the kinds of questions that we get asked quite regularly on our helpline. So we have a helpline at Glaucoma UK, and people can call in and can ask us all kinds of questions, and eye drops are a very common theme. So one of the questions that we hear quite frequently is, when should I use my eye drops? And as you will find with many of these questions, there is absolutely no hard and fast rule. And the answer is on time, every day, as your eye specialist has prescribed them. So different people will need to use different eye drops different numbers of times a day. So they might be drops you use once a day, they might be drops you use twice a day, they might be drops that you use 3 times a day. But however your eye specialist has prescribed them, please make sure that you're taking them that number of times each day. It's really, really important that you get the spacing of your eye drops correct. So if they're once a day, it's really important that you take them at roughly the same time every day. So if you get up in the morning and brush your teeth every morning, wonderful, pop your eye drops with your toothbrush every morning as you're getting up. Take your eye drops so that you're getting into a routine and they're a similar time. If they're morning and night, toothbrushes are a great place as well. If they're 3 times a day, having a little think to see if there's anything that you do 3 times a day, maybe somewhere in the kitchen when you're preparing food or something like that. So when you're doing your breakfast, when you're doing your lunch, when you're making your cup of tea to take up to bed at night or something like that, so that there is an even spacing across the day. If they're 3 times a day, you can't take them at 9 o'clock, 10 o'clock and 11 o'clock. The way that the eye drops are designed means that you need to have, as far as possible, the same amount of time between each dose in order to keep that eye pressure constant. Because they're a topical medication, they're going straight into your eye. They're being put into the place that they're being used, the effects do wear off quite quickly. So if they're a 24-hour drug, after 24 hours, they're not going to be doing what they need to be doing anymore. Sometimes people comment that they're not sure whether or not the eye drop has gone into their eye. So most eye drops can be kept in the door of the fridge, which can make them feel cold, which makes it easier to tell if the eye drop's gone into your eye. It's much easier to feel a cold eye drop going in than a room temperature eye drop going in. We also say to people, if you're not sure, pop another one in. It's good not to do that all the time, but if it's an occasional thing, you're better off having 2 drops because the excess will just run out than not having your drop at all. If people are using more than one eye drop, there may be more than one glaucoma eye drop that they're on, or they may take drops for other things as well. We recommend that everybody leaves 5 minutes gap in between the different eye drops that they're taking, so that one eye drop doesn't just wash the next eye drop out. As I just said, if there are too many drops in the eye at the same time, the eye can't absorb them all at once. So they'll just wash each other out. So in order for all of them to be effective, leaving that 5-minute gap is really important. We also get asked quite frequently about how to store eye drops. Our first bit of advice is always to read the patient information leaflet. I absolutely understand that they're not always the most easy to read, tiny little writing on very flimsy pieces of paper. So please do ask for help. And if you're really struggling, our helpline can give you advice. If there are eye drops and you can't read the leaflet and you haven't got anybody else to be asking, please do give our helpline a call. They will be able to give you some advice on what you need to do. Most eye drops are stored at room temperature, or are recommended to be stored at room temperature. We do recommend that this isn't right next to a radiator or in direct sunlight. Some kind of residential homes that older people may live in can be extremely hot. So if it is very, very hot where you're living, you might want to just pop them in the door of the fridge. If you are putting them in the fridge, it's really important that you've got some kind of really strong routine to make sure that those eye drops are not missed. It makes it much easier to remember your drops if they're somewhere that you see them all the time, because you know, that can be a visual reminder or that you need to take them. So having some kind of system like an alarm on your phone or something like that, an alarm clock that could trigger your memory to take your eye drops if you're storing them where they're not visible, could be a really good idea. It's really important not to keep eye drops for more than a month after you've opened the bottle. So we do recommend writing on the box or the bottle itself when you opened them. These little bottles can be an absolute perfect spot for bacteria to multiply. So although they're often packed full of preservatives or in super special fancy preservative-free bottles, making sure that you're not keeping them for too long is really, really important. If you are traveling, it is equally important that you continue to take your drops. Unfortunately, going on holiday doesn't mean a holiday from eye drops as well, but you can get cool wallets that will keep eye drops cool for up to 45 hours. They're available through Glaucoma UK, or you can get them on lots of different online shops, and I believe places like Boots and Superdrug sell them as well. So do take them with you, do continue to take them, and you know, make sure your eyes are staying healthy whilst you're on holiday as well. We get asked lots and lots of questions about, how do I put my eye drop in? I've been taking eye drops for 3 years and I still find it really, really difficult. Number one, top tip, make sure you're washing your hands first. Some of the eye drops will need a shake before you put them in because of the way that the medication is made up. They need shaking each time that they're used. If you then use your clean hand, to pull down onto your lower lid to make a little pocket in the bottom lid. Then you can squeeze the drop into there. And then we always advise people do something called punctal occlusion, which keeps your eye drop in your eye. So after your eye drops in, if you close your eyes, I'm just going to come a little bit closer to the camera, so hopefully you can see me. If you gently close your eyes, don't need to screw them up, just gently, gently close your eyes. And then with a finger, you press right in the corner of the eye by the nose for 1 to 2 minutes. And that will stop the eye drop running down through your tear duct, and some people report kind of a bitter taste when they take eye drops, and that's the eye drop medication going down into the throat through the tear duct. So punctal occlusion should help with that. Now, that all sounds reasonably straightforward, but we know that not everybody finds that desperately easy. So here are a few different techniques that people try that may make it easier to get that drop into your eye. Using a mirror. So top left picture here, if you're able to see my slides, is using a mirror so that you can see where that eye drop is going. As once you've made that pocket, you can make sure that the eye drop then is falling into the pocket rather than down your cheek or anywhere else. Some people really like that. Some people find it a bit disorientating. I know when I'm doing things in the mirror, I think I'm going one way and suddenly I'm going the other, and it all ends up in a bit of a mess. But lots of people do like using a mirror. The second picture at the top is what we call the bridge of the nose technique. So in order to do this, you need to be lying down. You need your head right back. And then you can see the bottle there is balanced on the bridge of the nose. So you've got the center of the bottle on the bridge of the nose, and then the end of the eye drop bottle is halfway into over the middle of your eye. So that can then be squeezed whilst it's over the eye, and that drop will drop straight down. Thanks to the work of wonderful gravity, straight into the eye. Some people do find, if they're laying, that the eye drop will want to kind of run towards the side of the eye, towards the ear. So they might want to just turn their head in the opposite direction, just to make sure that the eye drop stays within the eye. The third picture, this bottom picture here on the left-hand side, is a technique called the wrist or knuckle technique. And this is one that we find lots and lots of people really like. It's a little bit fiddly to get your head around to start with, but once you've kind of perfected it, it really does mean that the bottle is in the right place. When you then go to squeeze the bottle, the drop should fall directly where you want it. So if you take a fist with one hand and you place it underneath your eye, you can gently use those knuckles to pull down the lid to make a little pocket. If you've got the eye drop bottle in the other hand, you can then rest the wrist onto the knuckle, tilt your head back, and that will, as you squeeze, the drop will go into the little pocket at the bottom of the eye. And then the last picture there is showing somebody practicing punctal occlusion, the closing of the tear duct with the finger in the corner of the eye to stop the eye drop running down your throat. So they are some different techniques that people use. I will also say at this point, if people are still finding parts of administering their eye drops tricky, there are lots and lots of aids that can help you. There are aids that can help you get the lid off the top of the bottle, which is something that some people find tricky. If people are using individual vials rather than bottles of eye drops, there are aids that can twist the quite difficult tops of the vials off. There are aids that can help to position the eye drop bottle in the right place over the eye. Some people struggle with the mobility in their hands and their shoulders. So there are compliance aids with long handles that can mean you don't have to lift your arms up so high. All of those you can ask at your hospital about. or you can ring our helpline and they will tell you exactly which aid you will need. But for most of the issues that people struggle with their eye drops, there are aids to help. So please don't just struggle on or stop taking your eye drops, because it is tricky. Another thing that people often want to talk to us about is the side effects of eye drops. And it's very, very common for us to hear that, oh, I haven't had any problem. I didn't have any problems with my eyes until I started taking eye drops. And now they're red and they're itchy and they're sore. And it can cause some people to stop taking their eye drops, which is, really, really not great. So we always recommend to people that if you are experiencing side effects, please speak to your eye specialist. You don't have to wait till your next appointment. You can call the eye secretary. You can get a message left for your consultant. If these side effects are getting to the point where you're not wanting to take your drops anymore, speak to somebody. There are things that can be done. Punctal occlusion will help with some of the side effects. It will keep the eye drop in the eye so that it's not entering the rest of your body as much. Some people have a real reaction to the preservatives that are used in eye drops. The great news for people now is that there are more and more preservative-free eye drops that are available on the market, and they're becoming more and more affordable. So if you are getting red, sore, itchy eyes, it's quite likely that it's the preservatives that are causing that. So ask your eye specialist for preservative-free drops. 50 to 60% of people with glaucoma also have dry eye or blepharitis. And that's because we're applying lots of topical medication to our eyes. So there are things that can be done to help that. You can get lubricating drops for your eyes to help with dry eye. You can do special programs of eye hygiene and eyelid hygiene to help with blepharitis. And there are booklets available on the Glaucoma UK website, or the helpline can help you out if you're struggling with either of those things. Don't suffer in silence. Don't stop taking your drops because of the side effects. Speak to somebody. Let's find out if there's something else that can be done. Here are a few other questions that I would just whiz through. I've picked up my prescription, but the eye drops look different. Have they given me the right ones? This is quite a common question. There are often two names for different eye drops. For example, Xalatan is also the drug latanoprost. Xalatan is the brand name. Latanoprost is the generic name. It's a bit like ibuprofen and Nurofen. Same medications, they'll do the same job, but different bottle, they may be a slightly different design. So don't worry. How long do I need to take them for? As Liz touched on, eye drops usually are for life, so please don't stop taking them unless your eye specialist tells you to for any reason. How do I know if my eye drop's gone in or is working? It can be useful, as I said, to keep the eye drop in the fridge, to give it a colder feeling in order to be able to tell whether it's gone in. The only way really to know if it's working or not is to attend your hospital appointments, to have all of your tests redone, to check the eye pressure, to see if that is bringing the eye pressure down. I can taste the drops in the back of my throat. As I said, that can be prevented by doing the punctal occlusion. That will stop the eye drops going through the tear duct and into the throat. And my eyes are red, gritty, and sore. Is there something I can do? Speak to your ophthalmologist, speak to your eye specialist, see if you can get some preservative-free drops. Over to you, Liz. I'm conscious that we are running a bit tight on time, Liz. So if you do this, and then we'll finish up for questions, okay?
Great, thank you, Robyn. As I said at the beginning, Glaucoma UK provides a number of services. So let's look briefly at what these are. First, our helpline. As Robin mentioned, we get all sorts of questions to our helpline. Anyone can call with any questions about glaucoma, whether it's about drops, what is glaucoma, about other treatments like laser or surgery, or if you've got a question about whether you can drive with glaucoma or need help with something else, anything at all related to glaucoma, give the helpline a call and they'll do their best to help. They're open 9:30 a.m. to 5 p.m. Monday to Friday, and you can get in touch with them by calling 01233 648170 or emailing helpline@Glaucoma UK. And I will repeat those details again in a moment in case anyone needs to run and get a pen or something. Second, slide 17, please, Robin. Second, our buddy service. If you're considering or worried about treatments, particularly if you're offered glaucoma surgery, our buddy service can pair you with someone who's already been through that procedure. So they can talk to you about it and hopefully answer your questions and put your mind at rest. And if you want a buddy, again, call the helpline and they can try to match you up with someone. Slide 18, please, Robin. We also offer glaucoma support groups. And at the moment, most of these are online. We call them digital glaucoma support groups. They're a little bit like this session. They run on Zoom. We invite a guest speaker. That might be an eye consultant. It might be an ophthalmic nurse, a pharmacist, an optician, optometrist, somebody with experience of glaucoma. And they do a talk, and then there's an opportunity to ask questions. Upcoming sessions, for example, include one on glaucoma and genetics. It's on the 23rd of March. Experiences of 2 different types of glaucoma surgery on the 26th of April, and one on minimally invasive glaucoma surgeries on the 4th of May. Anyone can join, they're free. And if you go to our website, that's glaucoma.uk, all of the details are on there. And we'd be delighted if any of you wanted to join us. We are also starting to do face-to-face glaucoma support groups in some areas, but unfortunately, at the moment, they're not in all parts of the country. Slide 19, please, Robin. We also provide an online forum. This is run through the Health Unlocked website, moderated by Glaucoma UK. And if you want to chat to other people with glaucoma or ask a question to Glaucoma UK staff, you can put it on the forum and anyone else who's signed up to the forum can respond. So it's really good if you want to share experiences or hear about other people's experiences. We do moderate it to try to stop the spread of misinformation, but we also want it to be a space where people can interact amongst themselves. Slide 20, please, Robin. Finally, as Robin mentioned, we do a range of booklets on lots of different issues relating to glaucoma, ranging from really introductory things like what is glaucoma, through to things about surgery, eye drops, driving, lots of different things. These are all available on our website, so you can have a browse through, see what there is, see what's of interest, or you can phone the helpline and request hard copies. All of our services are free, so if you want to make use of them or just find out more, then please do get in touch. Those helpline details again, 01233 648170 or email helpline@glaucoma.uk. So we've given you lots and lots of information. I'm sure you all have questions. So we'll stop yapping at you now and let you ask us questions, and we'll do our best to answer.
Thank you, Robyn. Thank you, Liz. That was excellent. Really lovely and clear. Now then, people want to unmute themselves. There's a new way of unmuting, which Anthony has taught us. If you have the space button on your device, computer, laptop, you press that down and keep it pressed down, and you unmute yourself. So there you go.
Tim, can we stop the presentation running, please, so we have a bigger screen? Sorry.
No worries. Is that better?
That is.
Yeah,
thank you, Robyn. Robyn did that, not me. Okay. I've got a question I'd like to start off with, if you like. The other week, I work for Sight Advice, and the other week on our desks appeared a load of spectacles with holes in. I don't know where they came from. No notes, no nothing, but they are for eye drops. Have you heard of these? And are they? What would you say about them? I have no idea where they came from, and there's no instructions. They're just spectacles with holes in the middle, and they're clearly aimed for eye drops. What do you say to that, Robyn, or Liz?
Have you heard of them before, Liz? They're new to me, I must say. We have a whole range of compliance aids, but they're not one that I've seen or heard of before, and they certainly didn't come from us.
Yeah, they literally got a hole in, not a big hole, but literally got a hole in the middle. So I imagine you lie back, and I don't know, but there you go. Okay, not recommended because you haven't seen them. Okay.
No, certainly a new one.
Are you sure it wasn't to show RP? Was it not a spec sim?
Was it what from, sorry? Yes,
for RP, for retinal pigmentosa, just so you can see how. Yeah, that's what I mean.
Yeah.
But, I know what you mean. No, because they weren't sort of blacked out at all. Okay. Anyway, there you go.
I mean, you can buy those things, those plastic things that just sit on your eye sockets, and then you can kind of keep your eyes open. But yeah, I think it's best if you try to do it by hand or get somebody to help you, I guess, if it's possible. Tricky one. Would anybody like to come in and ask a question or make a comment or share something?
Yes, it's Brian speaking here.
Hi, Brian. Morning.
Yeah, it's not so much a question. I've tried many eye drops. I've had I've had laser. I had laser. Sorry, I could get that. And it was decided in September of last year that I need surgery, and in November I had a stent fitted in my right eye, and which seems to be quite successful. I'm now going to leave back to the surgeon on the 24th of this month to have the left eye done, have a shunt stent put in there. Didn't seem to hear much about this until it was mentioned to me. It was quite, an unknown area, and I don't know how other people have dealt with this, or whether it's been successful or what.
Yeah, how have you found it, Brian? I mean, we generally hear very good things about the stents.
Yes, because it was my local hospital in Sutton, and the surgeon was very good, and I've been back for checkups, and there's been no problem with it, and so they have decided now that they can go ahead. So the 24th of this month, put the stent in the left eye.
Brian's pressure has gone right down.
Brilliant.
It's gone right the way down. That's why they're going to do the other eye, to try and get pressure down in that eye.
Fantastic. So are you drop free in the eye that you've had the stent in, Brian?
Yeah, I'm drop free now. I've just been released. I mean, at the peak of this, obviously, when I had the glaucoma with the two eyes, I had to use 13 drops a day after the initial operation.
Goodness. Yeah,
and that was quite a work of art, but it had to be done. So it was 9 in the right and 4 in the left. So there you go.
Oh, well, fingers crossed you've got a drop-free future, and that the second one is as successful as the first. Thanks for sharing
absolutely.
that.
Thank you.
Thank you.
I have a question, because I also have ocular hypertension. My mum went blind with glaucoma, So I've had my eyes tested for years and years and years. The only thing I'm finding difficult is getting them tested. The appointments now, it's not very easy, and my pressures keep going up and up and up. And I'm not really, I go to Moorfields, but I go to a branch of Moorfields. You don't actually see a doctor, you go for the tests. The doctor examines the tests, he sends you back a letter. But 2 years ago, I was told I needed laser to bring my pressure down, and I've not heard a thing.
Okay. It's so they call those kind of clinics diagnostic hubs or virtual clinics, and they are being used to try and get as many people kind of seen as and having the diagnostic tests done as possible. But as you say, yes, it often means that you're not being seen by anybody. What I would suggest, if you were told that you would need some laser surgery, is that you get in touch with the eye secretary for the diagnostic clinic and let them know that you were told that, because they can usually, it would need to be done by a consultant, but they can do the SLT laser that I imagine it would be within clinic and things. So I would just make sure it's back on their radar, because all kinds of things have happened in the last couple of years. So yeah, don't be afraid to say, I was told this and I haven't heard anything since.
Right, lovely.
Robyn,
thank you very much. Thank you.
Robyn, what about going to your GP? In this case, is that advisable maybe just to go back to the GP and then get the GP to write a letter?
I would try the eye clinic first, but if you don't get any joy with the eye clinic, then absolutely make sure that it's being kind of raised.
Coded, yeah. How long would you wait for an answer in current circumstances? Like maybe if you don't hear from 2 months, would you then go to your GP?
I would, if you've contacted the eye secretary, I'd wait kind of a month or so, but I wouldn't leave it too long. Otherwise, it's just going to be going further and further down in somebody's inbox or to-do list.
Robyn, Liz, thank you for the presentation. It was really good. Just a quick briefly, it's only about 15 months or so ago that I was diagnosed with glaucoma. I had a really bad pressure pain in one eye one evening, and it felt like my eye was going to pop out. So I took some painkillers, went to bed, and I noticed it was blurry the following day. I phoned my GP. She said it wasn't glaucoma because you don't get pain with glaucoma. So she even I've even got the text. She even got me to send a photo of my eyes so she could look, and she texted back to say it wasn't. She did refer me to a optician, which took a week to come through. He said he thought it was, but he said wait till Christmas. If you don't hear by then, we'll follow it up for you. So that was like 3 months away. Within 3 weeks, my eyes had got really, really bad, and I luckily I went private, and it was then that they discovered I had really bad closed angle glaucoma, and I'd only got about 35% left in my left eye and 60% left in my right. And I had the iridotomy there and then on both eyes. The pressures came down from over 40 to they're now 12.
Wow.
But I'm struggling with the emotional side of it, to be honest. It's more just trying to get over why it all happened, because I thought I was obviously done all the right stuff. Is there any sort of advice or any help you guys give on that sort of account? Because I thought I'd phoned the GP, told them my mum had glaucoma, which was able to think which is what it was. They said it wasn't. The optician took 3 months to refer me, so we came away thinking it wasn't that bad, and then obviously within 3 weeks the optic nerve damage had been done, and I was just struggling really every day, just quite emotional, trying to work out how I've lost what I've lost when perhaps some of it could have been saved.
Yeah, absolutely. I think the first thing I would say is it's a completely reasonable way to feel, especially when, as you say, you had done what you could or should have done in order to try and save that site. Liz, do you have any? I would definitely say if you want to talk about it, please do call the helpline. Liz, do you have anything that you would kind of suggest or any thoughts around the emotional side of things?
Yeah, well, as Robin said, do give the helpline a call because they will be able to help. I think also it can be really helpful in these sorts of situations to share experiences with others who have been through it. So our online forum might be helpful. You might be able to chat to other people who've had similar experiences. There might also be things in your area that could help.
Local one called, which is now reopened. So I actually went there yesterday. So met a couple of guys there. I've got the glaucoma, so I did actually chat to them.
Great. And have you spoken to an iClinic liaison officer at all?
No, not yet.
No.
Yes, you have. Sue is an iClinic liaison officer.
Yes,
sorry, Mark.
Sorry, yes.
Okay.
So, but I've not been registered, partially cited, nothing like that yet, because of the site that I have actually still got and still able to read the charts and things. So. But yes, I have been getting different things, and I'm also got a care worker with the mental health team to try to some different other therapies to try use aromatherapy just to try to do relaxation techniques and that sort of stuff. So.
Yeah.
I mean, the only other question I have actually got, if you don't mind, is that I've also, as a result of the iridotomy, I've also got cataracts in both eyes now. The cataract, I've also got what's called floppy iris syndrome as a result of another medication that I take. And the combination of the glaucoma, the floppy iris itself means that the cataract operation, I've been told, can be a little bit more complicated. And I just wondered whether or not you got any information on that side of it, perhaps as to how the cataract operation can affect the glaucoma side.
There certainly are interactions between the two, and because of all of the things that you've got going on with your eyes, our recommendation would be that you talk all those things through with your consultant, so that he knows all of the different kind of factors that are at play. But cataract surgery is now often being used to help in the management of glaucoma as well. So it may end up actually helping, but what I would suggest is that you think of all your questions before you go to an appointment, so that you don't get to the end of the appointment and think, oh, I never asked about this, or actually I didn't get clarification on that. And do make sure you keep asking. If they give you an answer and you're not really sure, ask again. Say to them, I didn't really understand how you explained that. Can you talk me through it a bit more?
Yeah, and also Mark, try not to go alone. Apparently,
no, my wife comes with me.
Yeah, there is apparently like a study when you go alone to a doctor, you tend to listen to the first 10 seconds, and then you don't remember anything else.
Yeah, my wife always comes with me because the anxiety I'm having with it anyway, I've got permission from the hospital that I can actually take someone.
Yeah, of course.
My wife always comes with me on that. I think I've heard that after cataract operation, for the first 48, 72 hours, the pressures can go up. And I think the reason my consultant doesn't want to do the operation just yet is that he's worried about it spiking and causing more damage to the optic nerve. So he's holding back a bit rather than until I absolutely necessarily need it.
Well, there is always a risk, Mark, with every operation. There is. Thanks, Mark, for coming forward and
thank you
sharing.
Can you hear me?
Yeah, I can. Morning.
Hello, it's two questions really.
Okay, carry on, please.
Well, I'm going completely blind from glaucoma. I've got advanced end-stage glaucoma, well, they call it extremely advanced, and also a very rare retinal disease. But I just wanted to ask, well, actually, I'm very resentful as well, because I was taken off all eye medication for glaucoma a few years ago when they thought they couldn't see anything wrong, any cupping or anything. When I went back, they said it's 98% finished. There's nothing I can do about that, but I'm very, obviously very upset about it. But I just want to ask two things. One is, with my condition, it keeps going very dark for hours every day, which is freaking me out. 1 minute is light, next minute it's like in twilight, really dark. So I can't, see anything to make a meal or identify anything. And people keep being ambivalent if it's sorry, I've just got to select one. If it's from the retina or from the optic nerve. Just taking. Yeah. So you see that people don't. I just get really scared because it keeps going so dark, and they're telling me that it's due to the optic nerve and the glaucoma, which is the pressures are normal, but that's what they're telling me. Have you ever heard of any person with glaucoma who experiences these massive fluctuations, light, dark, intense glare? It can go dark for 27 hours. I had the other day. It was a nightmare. And each time I think it's going to go, because they said to me, it's going to be longer and longer periods of dark, but they're not saying, nobody seems to know why. They say it's not normal with glaucoma. My consultant said in all the years he's been dealing with glaucoma, he's never come across anything like that. Have you ever heard of it, even as anecdotally,
Well, actually, I have. I also have glaucoma, secondary glaucoma. Yeah. And I used to have similar experiences. So my vision would fluctuate quite a lot. I would, like you, I would really suffer from glare, and then things would seem really dim. Yeah. So I personally have experienced something very, very similar. But I think what you've been told is right. It's actually not common at all with glaucoma to have that kind of thing. It's normally, there is gradual deterioration. It doesn't tend to fluctuate as much as some other eye conditions do. No. But yeah, you aren't alone is all I can say, really. It's unusual, but you are not the only one who's experienced it. And yes,
I can't understand how a consultant's never come across it if they, just treating glaucoma. Mm. It's just upsetting, really. And I don't know what to do when it goes so dark. People say take your mind off it, have a talking book, something like that, but you can't when it's really dark. It's just horrible. The other thing I wanted to ask is, it's trivial, really. It's just that I read somewhere that even though my pressures aren't high, that certain foods or something like caffeine can raise the pressure, and also exercise they recommend to keep it down. Is there any truth in any of that?
There are certain foods that we recommend that are generally good for health. So lots of green leafy vegetables, oily fish, all the things really that are generally good for health are going to be helpful to some extent. But there's nothing that you sort of don't fall into the trap of thinking, oh, if I eat carrots, I'll be able to see in the dark. Oh, no. It's not as simple as that. But basically, if you have a healthy lifestyle, then that's going to be good for all of your body, including for your eyes.
I take a lot of painkillers, including caffeine, and I heard somewhere that that's bad for glaucoma. I don't know if there's any truth in that one.
Robyn, have you heard anything specifically about that?
Well, there are statistics around that say if you have 5 or more strong cups of coffee during the day, it can increase your eye pressure, which I can only assume is down to the caffeine. So it may be increasing it slightly, but again, if you're needing those painkillers, potentially if non-caffeinated ones work effectively for you, then you could try switching to that. Or you could try speaking to a medical professional to explain that situation.
Or cope,
there are lots of lots of medications that can impact on your glaucoma. So it is important to be having those conversations about medication you are taking and things.
Okay, thanks very much.
Thank you, Evelyn. Thank you.
Is there any studies being done in looking at perhaps actually repairing glaucoma? I thought I'd heard or read somewhere that some scientists had successfully regrown optic nerves in mice. in studies and stuff. Is that anything, do you know if there's anything like that going on and how far perhaps it may have got down the line or anything?
I do know that there is some research that's been happening, to regrow retinal ganglion cells, which they're hoping will kind of help with the recovery of glaucoma, but it is very, very early days at the moment. So I wouldn't be pinning too many hopes on it at the moment, but it is always being looked at, and scientists within the glaucoma field are always looking to see if there are things that they can be doing to try and recover sight. But yeah, there is a study. It's the retinal ganglion cells that they're particularly looking at. But yeah, mice and very early days.
Yeah, okay, thank you.
Okay, well, we're on 11:10 now, so you've gone well over, which is always a good sign. Can I just repeat the helpline number again for people, which is 01233 648 170. Please use that. I know that the Glaucoma UK, they're very good at getting back. They've also come to visit us at Sight Advice before, and the organisations, and did a real good session with us and all the local ECLOs. That went down very well. So I'd like to thank Liz and Robin for coming on World Glaucoma Week.
Live Well and Future Vision. We hope you enjoyed this presentation. The Live Well events take place on the second Thursday of each month at 10 AM. Future Vision sessions take place on the fourth Thursday of each month at 10 AM and are technology events aimed at people living with sight loss. To attend the next session or to suggest future topics, please contact your local Sight Society, who will be able to provide you with the Zoom link.